Good morning and thank you for waking up to Sunrise at Sea this morning. I am your host Sandra Kopp and I will be hosting the wellness segment this morning. If you just tuned in, you are right in time for that. And guess what? I am back at the Code Clinic. It is a dental clinic in Kamocha and I'm going to be talking to the good doctor yet again, Dr. Angela Kisa. And this morning we are going to be discussing braces. Now I know you all have questions about this and so do I, but guess what? Today we are going to find out. Good morning, doctor. How are you?
Good morning, Sandra. I'm okay. How are you?
I'm good, thank you. It's good to see you again.
You too. You look lovely.
Thank you. And as always, I have questions. And today we are talking about braces.
Yeah.
Maybe you can tell us what exactly are braces for those who don't know what braces are.
Braces are basically ways to align your teeth. Yeah. So people have different kinds of teeth because teeth grow differently. Some are extremely out forward, some are out back, some are crowded, some are they have an open bite and stuff like that. So there are many different reasons, cases, scenarios, but braces help to align those teeth, give you the perfect smile, your desired smile, like straight teeth and perfect bite.
Oh, okay. So are there different kind of braces? Because when we see people with braces, we just see people with that metal in the mouth. Are there like different kinds?
Yeah, there are different kinds. Here at Code Clinic, we do metallic braces, we do ceramic braces, and we do Invisalign. So metallic braces are the ones that you usually see on people's teeth, the metals, the wires, the colored things.
Isn't it uncomfortable?
No, it's not. It is for the first few days because they are putting something that is new and foreign to your teeth, something that you've not had before. So it will be a little bit uncomfortable for the first few days, but you get used to it and so it becomes a part of you. The other one is ceramic braces. So the ceramic ones are kind of like the metal ones, but for them they are more clear colored.
Oh, they're like see-through.
Yeah, they look more like your teeth.
Okay.
So people that prefer those ones are the ones that don't want the attention that comes with having
yeah.
So for them they're like, I want the ones that look like my teeth. And then the third one is Invisalign or clear aligners, which is nothing. We'll not put anything on your teeth. We'll just put a little bit of something that we call engagers, a cement. So we take measurements of your teeth, send them to the lab, and the lab comes up with a treatment plan for us. And then just how the teeth,
the model of the teeth.
The model of the teeth, and then how they can be moved. So for them, they are plastic. They are clear. If a person put them on and you didn't take time to notice,
you wouldn't know
that
there
is anything. There is no metal on the teeth, no brackets. It's just and those are the fastest. They work the fastest, but they are also for people that don't like the attention that comes with braces, especially adults, because the adults don't want to have there is a misconception of braces are for children and stuff like that, but there are people that have grown up and didn't have the opportunity to straighten their teeth as children and they'd like to straighten them now, so we give them that option as well. So it helps to move their teeth as well into line.
And especially for the metal ones, I'm a bit curious and I'm sure people are curious out there. How do they put them? Doesn't it take how long does it take to put them?
So usually we designate about an hour and a half to 2 hours to just do the whole procedure, because usually we're putting brackets. Brackets are the metal things that you see
for each
teeth. For each tooth we put a singular bracket.
Okay.
So those ones we take usually we're putting on both jaws, because usually if the upper ones are spoiled, even the lower ones are most likely disorganized or crowded or whatever other complaint we may have. So we designate and we put on each tooth from about 10 teeth, up 10 and down 10, from the premolar to the premolar, premolar to premolar.
So it takes 2 hours?
Yeah, about 1.5 to 2 hours, depending on how it goes.
Okay, you said there's a misconception that people think that braces are for kids. But at what age can kids have braces put in place?
Braces, we advise 13 years.
Oh, 13 and above, not lower.
Not lower, because we assume that at 13 years, a child has lost all their primary teeth and now
Okay.
the permanent dentition has come and it has fully developed.
Okay.
Why we want the child to be 13 is because we cannot straighten primary teeth
Because they're going to fall out.
come out anyway. So we can't straighten them, yeah? So we would rather wait until all your teeth are out and then the permanent ones have developed. And also development has to be from the crown to the root, right? Because if we try to move a tooth whose root has not fully developed, then it will probably fall out, it will be weak, it will shake.
Oh, okay.
Understand? So we have to wait until the child's teeth are fully developed and all at least their first two molars are fully out, and then we can start to align their teeth, because now we know that we are aligning teeth that are going to stay in the mouth forever as opposed to aligning primary teeth that are going to fall out. So 13 years. Okay, some children that are early bloomers, we can start at 12. So 12 and above.
And above. And
Yeah.
for how long should one wear braces? Is there a time frame, or it depends on the teeth?
Yeah, it depends on, because like we said earlier, people have different conditions. Yeah. So some people's teeth, for example, some people will come to you and they just want to close a gap between their teeth. And then another person will come to you and they have a really deep bite or an open bite. So the bites are the different kinds of bites. A deep bite is when the lower teeth overly bite into the upper teeth.
Okay.
And then an open bite if there is
Vice
a
versa.
space.
Okay.
The space open.
Yes,
So there is,
okay.
Then an overbite is when the other teeth have
The upper teeth are-
yeah, that protruding. Yeah, so people have different cases. Someone will just want to close the gap, and someone will just want to move one tooth, like a tooth was very intruded, like very inside. They just want to bring it out. So you cannot put a time frame to it, because for the person whose tooth is just inside, it would take 4 months. And then for the person whose teeth are crowded and stuff, it could take a year and a half or 2.
Okay.
You understand? So we determine the time according to whatever your condition is.
Okay. What about the cleaning process? Isn't it? Imagine you have something else in your mouth,
Yeah.
and already keeping hygiene
Yeah.
in the mouth is.
Yeah, so usually it's hard for people that have braces to clean. So we teach them properly how to brush, because when you're brushing teeth that have braces, because already without braces, food is
Yes,
sticking in your
sticking,
teeth,
exactly.
sticking under your gums. Now you have something, and this something has enough space to trap
The
food,
brackets
right?
and
Yes.
everything.
So you have to really, really brush your teeth gently. If you used to brush for 2 minutes before, now you brush for 5. Because
Wow.
you take time on each tooth so that you make sure that there is nothing. But also we have very small brushes that we call interdental brushes that we usually give to our patients so that they can help them get under those wires, get between. And yeah, so we advise that people be very careful when they're brushing their teeth, because if they don't, then the gums swell. Remember, we said that when the gums swell, a lot of things can happen. They recede, tooth loss, all those things. And remember, when we're moving teeth, we're already applying force to
Yes.
move the teeth from wherever they are to where we want them to be. So if you add gums receding to that, it just might lose your teeth. So we want them to take as much time brushing those braces and the teeth as much as they can, because we need their gums to be healthy for us to be able to do our job properly. Yeah.
And lastly, as we wrap up, many people have this view that if you see someone with braces, they are literally like putting their money where their mouth is. Are they affordable? How would
Well,
you?
affordable is
Relative.
relative, but I think they are affordable, because again, you are investing in your smile. Yeah?
Yes.
So if you want to have the perfect smile, then you'll go the extra mile. They are not as cheap as the normal procedures, like if you came to do a cement or to clean your teeth. It's not the same price range.
But you're investing in yourself.
Yeah, but you are investing in yourself. So they are, yeah, I think that you can do it.
At least now
Yeah.
I know much more about braces. Thank you, doctor. Thank you for that insight. Well, that was all from Dr. Angela Kisa here at the Code Clinic in Kamocha. It's a dental clinic, and she has been telling us today about braces, why to wear them, the different conditions that people have, how to keep that oral hygiene, and make sure you brush for 5 minutes. If you're brushing for 2 minutes, make sure you have to brush for 5 minutes just to keep your hygiene. Well, that was all that we had for you on the wellness segment this morning with me, Sandra Cope. But don't go anywhere because we'll be right back.